In today's session, we will be discussing about pedal edema in chronic kidney disease along with its causes and treatment. So first, let us see what chronic kidney disease is. The continuing and permanent damage of the kidneys is known as chronic kidney disease. The kidneys are a vital organ in the human body. They serve a variety of purposes including maintaining the body's fluids and electrolyte balance, assisting in the production of red blood cells, maintaining the acid-base balance of the blood, and excreting water-soluble waste. Kidneys that have been damaged, they lose their capacity to execute these functions. Now, there are 5 stages of chronic kidney disease. In CKD stage 1, the kidney function is near normal but structural damage is already there. In stage 2, the kidney filtration function, that is known as GFR, it is mildly decreased to 60 to 89 ml per minute. In stage 3 CKD, this function decreases further to 30 to 59 ml. In stage 4, the kidney function is severely compromised and the GFR is 15 to 29 ml. And in stage 5, where we also known as kidney failure, the percentage of kidney function is less than 15 ml, and this is the stage where the patients usually require renal replacement therapy in form of dialysis or kidney transplant. Since the kidneys can compensate for lost functions, the signs and symptoms usually do not appear until advanced damage has occurred. So some of the commonly observed symptoms in chronic kidney disease are swelling of the feet and ankles, nausea, vomiting, lack of appetite, sleep problems, breathing difficulty, urine problems, diminished mental sharpness, muscular cramps. This can be there. As we have looked at the signs and symptoms of chronic kidney disease, one of the major symptoms is swelling of the feet or pedal edema. So what is pedal edema? So pedal edema is nothing but the swelling of feet and ankles, and it is caused by an abnormal buildup of fluid in the ankles and feet, and usually sometimes it also goes up to the lower legs. Edema of these feet can be caused by basically 2 different mechanisms which can occur separately or which can occur in unison. So let us see how this pedal edema is linked to chronic kidney disease. So edema forms in chronic kidney disease because of 2 reasons. Either there is a loss of protein in the urine which is quite significant, or there is impaired water excretion by the kidneys. Now, nephrotic syndrome is a condition where there is significant loss of protein in the urine along with edema. A decrease in the protein called albumin in the blood results in the reduction in the fluid of the blood vessels as the water moves out. So thus kidneys detect this decrease in blood volume and attempt to retain salt. As a result, fluid collects in tissue which are in the dependent part, resulting in edema. This pedal edema can be detected early while on standing or sitting in the same posture for an extended period of time. The signs of pedal edema include swelling and puffiness of tissues just beneath the skin. Skin is usually stretched and shiny, and skin retains a dimple or it pits when you apply pressure for several seconds and then remove your hand. Let's now take a look at the ways to reduce pedal edema caused due to chronic kidney disease. So treatment of edema includes addressing the underlying cause, that is by lowering the salt intake or the fluid intake, and in many cases using a diuretic to eliminate excess fluid as well as the excess salt. It may also be beneficial for symptomatic relief to use certain compression stockings or to keep the legs elevated. Now, salt intake can be reduced, which is the cornerstone of this therapy, because edema can be exacerbated by increased sodium which is present in table salt and processed foods. So reduced salt consumption can help in minimizing edema. Second, decreased fluid intake. So that includes all form of fluids, whether it is water, milk, tea or soft drinks or juices. Then use of certain drugs can help you, like diuretics. These are the drugs that induce kidney to eliminate more water and salt, hence reducing edema, because eliminating too much fluid too rapidly can cause blood pressure, and it may cause lightheadedness or fainting, and it may damage kidney function if used without supervision. Thus, diuretics must be administered with caution and only with the advice of a doctor. After using a diuretic, sometimes you may need to empty the bladder more frequently, so better is to take these diuretics in the daytime. However, when diuretics are used at prescribed dose, adverse side effects are very less. We can also use compression stockings, which can use to prevent and treat leg edema. Although good measuring and fitting of stockings can limit the discomfort, certain stockings can cause skin irritation or pain where you have to discontinue their use. Effective compression stocking exert the most pressure at the ankle and they progressively decrease the pressure up to legs, causing good relief. Body positioning can also help alleviate the symptoms. Elevating the legs above the heart level for 30 minutes for 3 to 4 times in a day can help with leg, ankle and foot edema. However, if the patient is working, then elevating one's leg multiple times a day may not be feasible. Instead, he can use a stool while sitting on the chair. Lastly, it is possible to prevent chronic kidney disease by controlling diseases like high blood pressure, diabetes, thus reducing the risk of developing CKD significantly in the future. If you are at risk of developing CKD, you should get your regular testings done at least once a year. Early detection can aid in slowing its progression. Once, unfortunately, if you develop CKD, then limiting salt intake, taking fluids in prescribed amounts, having good physical activity, and if necessary, taking diuretics under medical supervision will help reduce pedal edema caused by chronic kidney disease. Thank you.